Hello, class. My name is Adriana Hurley, and I'm going to talk about decreasing diabetes type 2 in low income communities. The theme of my presentation is Health Up, Diabetes Down. Definition and statement of the problem. An estimated 23.1 million people, or 7.2% of the US population, have diagnosed diabetes. Non-Hispanic blacks and people of Hispanic origin had a higher age-adjusted incidence compared to non-Hispanic whites during 2013-2015. People who eat foods high in calories, sugar, sodium, and chemicals have a higher chance of developing type 2 diabetes. People who live in low-income neighborhoods consume more processed foods than people who live in high-income areas. Processed foods are cheap, addictive, and misleading. They are easily found in convenience stores where low-income families shop, where neighborhoods lack proper supermarkets or transportations to go to them. Therefore, social injustice poses a risk in increasing type 2 diabetes. Diabetes carries a big increased risk for cardiovascular disease, stroke, peripheral vascular disease, blindness, kidney failure, amputations, and nerve damage. This disease is also linked to other health problems such as sleep apnea, depression, some types of cancer, and dementia. Social injustice increases diabetes type 2. These are some pictures that I took when I was visiting some of my clients. I visited some patients in homes. This just happened to be around the block where I was going, and I found it very disturbing, and I found this scenario like very sad. These are actually evictions. You can often see these uh, pictures actually daily. You can see some people's property and possessions on the street. I can't even imagine being in a situation like that. This is going to be very stressful for the families. This is an everyday situation in this for this community. You can also see a lot of trash on the street. You can still see debris from Hurricane Irma that have not been picked up yet, and it's been many months now. Also, unattended pets, especially big dogs, are common to see unleashed dogs and loose dogs in front of the houses. Quick stores are usually the to-go place to buy food, and there is usually a lot of police activity in these areas as well, which increase the stress because there is always something going on. So yes, we have a problem. Even though type 2 diabetes is linked to body weight, high calorie diet, and a sedentary lifestyle, exposure to environmental hazards also play a big role in the disease process. Methods that I use to collect my data, the data sources that I analyzed were the ones from the CDC 2017, American Diabetes Association 2012, NIH 2017, Search for Diabetes in Youth Study 2011-2012, and US Census 2015. Percentage of diagnosed diabetes by race and ethnicity in 2015. The percentage of diagnosed diabetes in American Indians were 15%, compared to Black non-Hispanics 12.7%, Hispanics 12.1%, White non-Hispanics 7.4%, and Asians 8%. Percentage of prevalence of diabetes in people with Hispanic ethnicity in 2015. Mexicans had a 13.8%, Puerto Ricans 12%, Cubans 9%, 8.5% on Central and South Americans. Percentage of diabetes prevalence by education level as indicator of socioeconomic status in 2015. If the person had less than high school, it was 12.6%. A high school diploma gives you a 9.5% chances, and more than high school, 7.2% percentage of diabetes prevalence by education. Incidence of diagnosed diabetes in 2015, an estimated 1.5 million new cases of diabetes were diagnosed among US adults aged 18 years or older. More than half of these cases were among adults aged 45 to 64 years of age, and the numbers were about equal for men and women. Among children and adolescents younger than age 20 years, non-Hispanic whites had the highest rate of new cases of type 1 diabetes compared to members of other U.S. racial and ethnic groups. But among children and adolescents aged 10 to 19 years, U.S. minority populations had higher rates of new cases of diabetes type 2 compared to non-Hispanic whites. Conditions that appear to be associated with high prevalence of diagnosed diabetes, it is definitely the environment because it influences everything else. The environment influences the income level. The environment or the income level influences the environment, but it is reciprocal. The lower the income, the worse the environment. The higher the income, the better the environment. So race, ethnicity, because of the limited access to preventive programs, education, and the lack of awareness, the culture, national origin, due to their lifestyle, how unfamiliar they are with the policies here or the modern methods. They maybe had discouraging experiences, also diet, disability, and other health conditions. The alternative that I came up with is SNAP policy changes or food stamp policy changes. Of the approximately $2,300 spent monthly by the average low income household, 37% is spent on housing, food accounts for 19%, and transportation is 17%. I find interesting that the food stamps allow the families to buy cokes and sodas and high processed foods, but it does not allow the families to buy vegetable seeds if they want to make a change in their life. So maybe we need to work on policies and how we can educate the families and to kind of try to work towards that route. How about if the person wants to start growing some of their vegetables? Are we going to allow them to buy vegetable seeds? And how about restricting the SNAP funds only for fresh food and water, no more junk food? Another alternative was the adequate supermarkets to build these beautiful supermarkets in low income areas. That would be great. And my third alternative would be supply transportation to the supermarkets. It is a little more realistic. Maybe we can create the program where the bus can take these people for free to the supermarkets so they can actually have access to the food. Alternative number one, I call it going back to our roots. Florida's climate creates a unique agricultural environment able to produce a wide variety of fruits, herbs, and vegetables. Some of these items can be planted in small places. Also, we need to raise our children with a horticultural mind where it is just a culture of garden cultivation. Create collaborations between botanical gardens, state parks, and the school system to incorporate gardening as a mandatory class, and the SNAP policy changes to allow population to buy vegetable seeds and limit funds to buy fresh foods and water. Little spaces, big changes. These are pictures of actually some people who live in Homestead. They let me take pictures of their plants. The first one is a lady who has a tomato plant in a little pot. The second picture is a chili pepper plant. Picture number 3 and 4, these pictures they just give me ideas in how I can utilize the little space and just create big things. I got those two online. Picture number 5 and 6. Number 5 is experiment, and number 6 is green tomato plant. So I can see that some people are already taking action, or they have brought some of their cultural practices to this country, which I think is cute. Alternative number 2, build supermarkets. Supermarkets, as compared to other food stores, tend to offer the greatest variety of high quality products at the lowest cost. So that is like a dream, but I think it's really hard. It's not. It's very expensive. It requires a lot of things to build supermarkets. Alternative number 3, provide transportation to supermarkets. That's more doable. I understand that we already have a trolley service in place. It is very limited because the trolley is mostly for visitors right now, and it is the most popular trolley routes includes the loops around downtown Miami and Brickell, as well as the new routes to Wynwood and the Design District. So we need to focus those funds and efforts to serve the underserved and allow our community to have equal rights to get food. Going back to our roots, primary care. eh, Doctors can start education during pregnancy and continue during childhood and adulthood. Pediatricians can identify children at risk and provide parental education. Also, link to education and to ensure parents have resources to be able to obtain services for children. The Wicca Nutrition Program can encourage healthy foods, routine testing, and linkage to education and food co op collaboration. Home visitors provide education and meet the parents where they are emotionally and physically, and they work with empowerment and independence and build capacity to support healthy nutrition. School based programs support linkages with botanical gardens and state parks. Parental education communicate the benefits of gardening at home. Small spaces can make a big difference. The criteria measure assessments, effectiveness, evidence based, and applicability. The cost to be integrated in the school system and collaborate with botanical gardens and state parks. Projection of outcomes, cost, and benefits. Most packets of seeds are inexpensive. A typical seed packet contains between 800 and 2,000 seeds. If you only harvested half of those seeds, you are spending 140 to $200 less than if you had purchased those mature vegetables from the grocery store. If you were to buy organic produce, the savings could be upwards of 180 to $300. If the clay soil lacks texture and breathability, sand or compost can be found at the garden center of nearby nursery or Home Depot. A bag runs from $3 to $10 for 40 pounds, which will cover about 4 square feet of topsoil. This is a vegetable calculator. You can use it if you think it's gonna be just to see if it's worth it to grow some type of vegetables. It just tells you what you need and if it's worth it. The trade-offs and caveats. Everglades soil tend to be peat-based and extremely fertile, but in extreme South Florida, soils are often shallow and have a high pH due to the influence of the limestone bedrock. One hidden cost to think about when starting up a garden is soil testing. If you are in the city or fear you have compromised soil, it is a good idea to get a soil test from your local garden center or home improvement store. These run about $12 but are well worth it because you don't want to plant any lead tainted dirt that will contaminate your food. Conclusions. Effective strategies for family and health integrations potentially exist. Even in particularly challenging populations, evidence based strategies can be adapted to ensure reach. Diabetes type 2 is preventable. Public health makes a difference in our communities. Please watch the video after the reference slides. Thank you. This video it is about a community in Homestead where actually they have being able to receive a lot of social help. They have schools inside this community where Title I is in action. They also have community health centers. They have parks, and they have a safe place to exercise and be with their families. And this is just to show how much we can help. Thank you very much.
Sueños se hacen realidad, si amo lo que haces, esa es la verdad, no importa más nada. Siempre con humildad, y frente en alto y mucha voluntad. Sueños se hacen realidad, si amo lo que haces, esa es la verdad, no importa más nada. Siempre con humildad, y frente en alto y mucha voluntad.
Me arrodillé, luego rogué, meditando aliado por lo que yo soñé. Yo quería ver, empecé a creer, y entonces mi sueño alcancé. Podía decir lo que iba a seguir, que el momento cambiaría todo mi existir. El corazón a mí no puedo resistir, felicidad vuelvo a sentir. Quiero celebrar y luego festejar. ¿Dónde está mi familia? Lo quiero abrazar. No todo va mal, vamos a gozar. Apenas esto va a comenzar. Arranque, empaque que no fuimos. Cada vez que el tiempo pasa se va mejorando el vino. No vino a lo que vino y quiero el destino. Porque mamá era gallo y mismo fue el latino.
Sueños se hacen realidad, si amo lo que haces, esa es la verdad, no importa más nada. Siempre con humildad, y frente en alto y mucha voluntad. Sueños se hacen realidad, si amo lo que haces, esa es la verdad, no importa más nada. Siempre con humildad, y frente en alto y mucha voluntad.
Toma tiempo, mera energía, que vienen mejores cosas y chuchitos por el día. No pensaría que mi suerte cambiaría, socio de donde yo vengo a mí no se me olvida. El querer es poder cruzar barreras, no hay nada que temer. Vamos pa'lante, la vida es una sola y el caer paso gigante. Los sueños que uno sigue, la moral más elegante. Quiero celebrar y luego festejar. ¿Dónde está mi familia? Lo quiero abrazar. No todo va mal, vamos a gozar. Apenas esto va a comenzar.
El alma se transforma, mi cuerpo se transforma. Voy a de una forma, la buena vibra brota. El alma se transforma, mi cuerpo se transforma. Voy a de una forma, la buena vibra alto y mucha voluntad. Los sueños se hacen realidad, si amo lo que haces, esa es la verdad, no importa más nada. Siempre con humildad, de frente en alto y mucha voluntad. El alma se transforma, mi cuerpo se transforma. Voy a mi rumbo forma, la buena vibra brota. El alma se transforma, mi cuerpo se transporta. Voy a mi rumbo forma.